Hi and welcome to Steps to Strides with me, Connor Ratcliffe, and we're back in the garage gym today and we're looking at some potential loading strategies for our peroneals. Now, today's exercise is a looped isometric resistance band eversion exercise. Try saying that 3 times fast, and that might sound quite similar to our looped resistance band eversion exercise. But the difference and the key point here, and why I'm doing a different video, is that it's looped isometric resistance band eversion. So this makes the exercise quite a lot easier and it makes it a regression. So it's less neuromuscularly demanding, it's less cognitively demanding, and it's still a little bit nuanced in our setup. So again, worthwhile me doing another video. So when we look at this, because it's isometric contraction and still similarly to just the active looped resistance band eversion video, we need to consider a few different points and we need to consider some different compensations, because what we don't want is for this to become an exercise that's actually targeting a different structure. So a flexed knee position makes it a little bit harder to compensate and use different structures as opposed to a locked knee position, which lends itself a little bit more to external rotation, so using our big powerful hip external rotators or abduction at hip. So what we want to do is typically be in a seated position or a position where we can be relaxed at the knees and be aware that we're not using more proximal muscle groups that aren't actually our target structure. Now, you would still get some engagement of our everters and the peroneals, but it might be that you find actually the abductors at the hip become the limiting factor, so we're not getting through to full therapeutic range within our lateral compartment and our actual target structures and our active everters. So to try and get over this a little bit, what we want to do is make sure that we set up with the band on a bit of resistance when we're in an end range inverted position. So just like this. That way, then when we actually add the resistance, the way we're going to add it is through just moving at the ankle. So nice relaxed feet, let the band pull it in to an end range inverted position. And then we're going to turn the foot out against the band into a neutral position. Now, you can take this all the way to end range eversion, but typically I find that's a bit more challenging for patients, but that would still be an end range concentric isometric hold. So it doesn't really matter too much. You can test this on assessment, but usually I would just take this to a neutral isometric hold. Now at the moment I'm doing this unbiased in the sagittal plane. So I'm not dorsiflexing or plantar flexing, I've just done this in a position that feels comfortable to me. And you can do that with patients, but it depends on the specificity or the individualization of what you're actually trying to do for that patient. So in a neutral position, it's fairly unbiased. I'm not really getting more of one structure or another. It's just going to engage all of my active everters. If there's a bit of a predisposition to extensor substitute and use extensor digitorum longus, well, you might find that actually it just takes over a little bit. You might have a little bit of what we call synergistic dominance, and we're not maybe getting as much peroneal engagement as we think we are. So in those sorts of instances, but when you really want to be a bit more specific to peroneus longus and peroneus brevis, then we can look at some similar cues to some of our other videos, especially in that looped resistance band eversion video. So this essentially means we just need to consider that sagittal plane positioning of the foot. So if we want to look at our peroneus longus and peroneus brevis a bit more, knowing that they're weak plantar flexors as well as everters means we can bias the start position. So in this instance, we can point feet down, point toes down, and that helps reciprocally inhibit and bias the load towards peroneus longus, peroneus brevis, and then tension on that end range relaxed inverted position, and then turn the feet out, keeping the toes pointed down, foot pointed down. See my toes wanted to engage a little bit there, I still had to think. And then we're going to hold in that isometric position. And then relax. If we did want to get more extensor digitorum longus or peroneus tertius, then we can put the position into a dorsiflexed sagittal plane. So pull the foot up, pull the toes up if you really want, and then you're holding in that neutral frontal plane position and relaxed. So again, after saying it was a nice simple exercise and less cognitively demanding, there are still some specific cues that are worthwhile going through with your patient, and obviously makes you earn your money a little bit, doesn't it? Rather than just Googling these or handing them out willy-nilly to patients. So as a bit of a recap, we're gonna nice relaxed foot position, bias the sagittal plane depending on the structure that you want. So in this instance, do we want dorsiflexed? Do we want plantar flexed? Let's plantar flex foot, plantar flex toes, and then we're gonna evert the foot, and then we've got our isometric hold. And relax. And that's looped isometric resistance band eversion exercise.